Okay, now, so looking at the hormone level for estrogen, for the level of estrogen, it will increase from when pregnancy takes place and continue to increase until the 9th month. So once the fetus is fully developed, then it would decrease. So the low level of estrogen would in return stimulates birth. The same pattern is also observed for progesterone. For the HCG hormone, this hormone is initially produced by the corpus luteum during the first few months, and then later on it remains low. Now, during birth, the sudden drop of progesterone and estrogen would stimulate birth to happen. So, the high level of estrogen during pregnancy, estrogen also inhibits oxytocin. So oxytocin plays a role in contraction. So now, at the 9th month, after the full term of pregnancy, the level of estrogen will suddenly drop. That drop of estrogen will in fact lead to now there is no more inhibition of oxytocin. So when there is low level of estrogen, the oxytocin level will in return increase. So increased level of oxytocin will then lead to the increased contraction of the uterine muscle wall. So this is actually a positive feedback loop, because the increased contraction, the muscle will start to increase, trying to squeeze or push the baby out. Now, the baby would also stretch. So the stretch receptors are also, so that would cause the lining to stretch. The stretching of the uterus lining will in return send a signal to the brain to release more oxytocin. So this is what happens during birth. In summary, during birth, high levels of oxytocin lead to high level of contraction. The contraction in return cause an increase in the stretching of the lining. The stretching of the lining will in return stimulate the secretion of more oxytocin. So this is a positive feedback loop between oxytocin and estrogen, and that would continue until the baby is born.